You know that feeling? You're sitting in a beautiful, state-of-the-art clinic, but everything just feels slow. It's a common story. Even the most successful places can have these invisible problems slowing everything down. Well, today, we're going to dive into how one clinic found a totally virtual cure for its very real problems. So let's set the scene. We're at a top-tier infertility clinic. I mean, on paper, they were a huge success, but if you pulled back the curtain, you'd find a completely different story. It was a story of, well, chaos. Patients were frustrated, and the staff was totally stressed out. And this is what that chaos looked like. You had all these different departments, but they were like separate islands, each doing its own thing. This just created a domino effect of problems, right? Patients were getting lost in the system, wait times were getting longer and longer, and the really critical teamwork, like between the labs and the facilities team, was just falling apart. So, to fix all this, the clinic brought in a new project manager in early 2024. His name was Iwin, and his mission? It was pretty simple, really. Untangle this mess and drag the clinic's operations into the 21st century. Now, Iwin didn't just come in with a few small suggestions. Nope. He had a radical, almost science fiction idea. He asked, what if we could build a complete, living, breathing, virtual copy of the entire clinic? So what in the world is a digital twin? Well, think of it like a virtual mirror of a real place, in this case, the clinic. But it's not just a static 3D model. It's a living copy that's constantly being updated with real-time data. This means you can see exactly what's happening right now, and even better, you can play around with scenarios to predict what might happen in the future. And listen, this wasn't just some cool tech experiment for the sake of it. Iwin and his team set some incredibly specific and honestly super ambitious goals for a one-year pilot. They were aiming for a complete operational makeover, and they wanted the hard numbers to prove it worked. Okay, so how on earth do you build a virtual copy of a complex clinic in just 1 year? Well, you don't do it all at once. The team broke it down into a 4-quarter sprint, taking this thing from a big idea to a fully functioning digital twin. And here's the game plan for that year. Quarter 1 was all about laying the foundation and setting that vision. You know, those big goals we just saw. Quarter 2 was the real heavy lifting, actually building the model. Quarter 3 is where the magic happens. That's the simulation phase. And then finally, quarter 4 was all about getting it into the hands of the staff. So in that second quarter, the team really got to work. They started turning the physical clinic into a digital world. I'm talking a detailed 3D model of everything, down to the last lab bench. But the real game changer was giving this virtual clinic a nervous system. And this is how they gave that twin its senses. They installed this whole network of smart sensors, basically the clinic's digital eyes and ears. You had occupancy sensors tracking how crowded waiting rooms were. You had monitors in the labs making sure conditions were absolutely perfect. And you even had sensors on critical equipment that could kind of feel a problem coming before it even happened. All of this data was just streaming into the virtual model, 24/7. Okay, so with the twin built and getting all this live data, the third quarter was where things got really cool. The digital twin became a what-if engine. It was like a safe, virtual sandbox where the team could test out any idea they had without disrupting a single real patient. So they just started running all these scenarios. Like, what if we space appointments 15 minutes apart instead of 10? The twin would show them exactly what would happen to wait times. Or what if a critical lab incubator fails? They could simulate the disaster and perfect their emergency plan. See? This isn't just watching things happen, it's getting ahead of problems before they start. All right, so that's the setup, a full year of planning, building, and simulating. But here's the million-dollar question. Did it actually work? Did they hit those super ambitious targets they set for themselves? Let's get into the results. First up, the one that patients felt the most. Remember that goal to cut wait times by 25%? Well, by using the twin to figure out the perfect appointment schedule, they didn't just meet it, they smashed it. They cut the average wait by a whopping 28%. That is a huge, real-world improvement for every single person who walked in. Next, let's talk about the equipment. Those little smart sensors we mentioned, they were basically an early warning system. The team could predict when a machine needed maintenance before it actually broke down. The result? A 19% drop in equipment downtime, which, saves a ton of money and headaches. They also found out they weren't using their space very efficiently. So by using the twin to optimize patient flow and reassign rooms on the fly, they boosted space utilization by 23%. And get this, That wasn't just a number on a spreadsheet. It meant they could now see 2 extra patients per specialist every single day. And the savings just kept coming. By linking the twin to the clinic's heating, cooling, and lighting, they could make smart adjustments based on how many people were actually in the building. The payoff? A 14% drop in energy use, which translated to thousands of dollars in real savings. But really, at the end of the day, this is what it's all about. All this amazing tech, it wasn't just about efficiency. Every single one of those operational mins, shorter waits, smoother visits, it all added up to a much better, more human experience. And you can see it right here. Patient satisfaction scores just skyrocketed, going up by an incredible 22%. So this is way bigger than just one clinic success story. It's really a blueprint. It shows us how we can shift from just reacting to problems in healthcare to actually getting ahead of them with smart, proactive management. And that's the big takeaway. The same technology that helps us build smart factories and virtual cities can be used to heal our healthcare systems. It can help us create places that aren't just more efficient, but also, more compassionate and humane. So it leaves us with this big question, right? What does an intelligent, efficient future for healthcare actually look like? Well, this one clinic gives us a pretty powerful glimpse. It's a future where data isn't just about spreadsheets. It's about creating a faster, smarter, and just plain better experience for all of us. For more information, you can reach out to Iwin through his LinkedIn.